Back on Morning Line, our guest with us this morning, Clint Kelly, malpractice attorney here in town. It's good to have him on. He's excellent at what he does. And we're going to take your calls at 737-7587. You wonder about some of the stories out there, cases. Just we're going to get to the phone lines. We have some lines open if you want to jump in. We can help you if you think you might have a case. But this is out of California.
Yeah, this lady who was a patient in California, and she was seeing a physician for a, I believe it was a plastic surgery, and was messed up. It was a botched surgery, and in the course of discovery found out that this doctor had been arrested for DUI multiple times. There were 24 previous instances of alcohol use on the hospital premises. The hospital assigned a, if you will, a counselor, supervisor to watch over him to make sure that he was sober, and it turned out that that supervisor was his office manager. He's no longer there. But it's, I guess because the demand for physicians is so high.
I was going to say, why did they keep him on? At that point, I mean, see you later. I mean, because he's going to create a problem for them.
He's probably a fee machine. He probably
making a lot of money
makes a lot of money for the hospital. You know, you want to get rid of your golden goose. At the same time, they think that they can get these people to change. And you mentioned Steve Sarkisian.
Yeah, the USC head coach who was just fired for substance abuse.
That's a tragic situation because he's basically lost his life within the course of about 24 hours. But he didn't kill anybody.
No.
And that's what's dangerous about this. I don't see this any different from a pilot who gets on an airplane drunk.
Yeah, if you're a doctor cutting on someone.
The only difference is that person's got maybe 150 people that he could kill as opposed to one at a time.
Holy cow. All right, let's take some calls for you. Let's go to Tanya Rose. Good morning, Tanya.
Good morning. I don't have anything about malpractice. I just think maybe I felt like my doctor just ignored me and maybe might have charged me too much. When it was a dentist, I requested to get individual implants. My teeth are getting old, so I had a bridge removed in the upper part and one in the lower part. So I requested that I have individual implants replacing those. Okay.
And what happened?
Instead, he gave me actually 2 bridges. But all my paperwork, as I went through this takes a while. I went through, it took about 8 to 9 months for everything to heal and be replaced. And it was bridges instead of the individual implants. But on my paperwork, everything is, I'm being charged for individual abutments, individual.
So you were paid for, you were charged. Your issue here is the billing. They not only did it not exactly what they said they'd do, but they're also charging you a lot more?
Well, that's what I felt because I did shop around before I went to get the implants, and different doctors said, well, I can give you a break on bridges. Okay. And I said, well, I really prefer individual implants. I can clean between them better. And
so your question is, I mean, is there something you can do about holding them responsible for not doing what they said?
Right, and because I do think that I'm paying for the individual, I think it costs more.
Yep, okay. And it's a little off base on this, but maybe 2 points you can address here. The question of when there's billings that seem out of hand, and that's not really malpractice. And 2, do you handle cases sometimes of malpractice involving dentists, or is it mostly just medical doctors?
Well, let's start first with what her situation is. Tanya's situation sounds like that she paid for or expected to get bridges, and it showed up as implants, or vice versa. I'm not sure which. Now, that's not a medical negligence case. That's a breach of contract case. Now, obviously, if you thought you were going to pay an X amount of money and you're paying Y, and you didn't get the service that you were supposed to be provided,
and you have it in paper, it sounds like,
and you have it in writing, then the dentist is going to be accountable for that. But it's not going to be a medical negligence case.
Gotcha.
Yes, I have had a case against a dentist. I had a case against a dentist who did a procedure and prescribed Meprogan, which is extremely strong narcotic. And what he did not check on before he administered the Meprogan was that she was also taking Xanax. This was 10 years ago.
Wow.
You mix Xanax and Meprogan together, you can put somebody to sleep for good, and that's what happened to this lady. She died that night when she went home because she was taking both of those drugs together.
Her heart just stopped.
Correct.
So now, is this where we're getting into the standard of care level? Would the standard of care mean if you're going to prescribe this powerful narcotic, one of the questions you have to ask the patient is, what else are you taking right now?
Any time you see a doctor or even a dentist, you know one of the first things you're going to be asked either by the dentist or by the staff is,
are you on any meds?
What are you taking? And she listed it there, and he just simply didn't look at the chart.
Oh, she did list it?
Oh, yeah. She put it on there that she was taking Xanax.
I thought maybe he just didn't ask. And
just didn't look. And then he brought in the pharmacy, alleging that the pharmacy should have picked it up, which they should have. So you had two fail-safe devices that were basically discarded. The physician looking at the chart and the pharmacy looking at the prescriptions, and because of that, she had a lethal drug interaction.
Oh, my God. Did you win that case?
We resolved it.
Same thing, I suppose. Yeah, the pharmacy, by the way, meaning that they should have seen, how would they have known she was on the Xanax?
Well, they have a computerized system that will, well, first of all, she was filling her prescription there.
Oh, okay, and so should it come up, and is it their responsibility to look at everything she's on, or do they just defer to the doctor thinking, well, she's on Xanax, but the doctor prescribed this, it must be okay?
No, they have an independent duty to check for drug interactions, because they're healthcare providers too, Nick. I mean...
Okay, so you've sued pharmacies as well?
Yes. Oh, yeah, and their responsibility is to check to make sure that the drugs they are dispensing don't have a dangerous interaction with another drug. That is a pharmacist's duty to do that. And if there is an interaction, that pharmacist is supposed to warn the patient and warn the physician. It's like a backup.
Yeah. Okay. It's interesting then. So what we're hearing here, we talk about medical malpractice. You think about maybe, surgery where they don't do the right thing, or a device moves inappropriately or something like that. But it's also meds too. If doctors make the mistake on medicines and things like that.
A lot of patients don't know that the pharmacies are not only obligated but do this. They check your prescription history to make sure there aren't any dangerous drug interactions.
Gosh, I didn't know that. All right, listen, on that, we've got more calls for you. Let's take a break. When we come back, Sarah, Ashley, Patsy, and others, we'll get to you. Phone calls, questions you may have for Clint Kelly, malpractice attorney, maybe a situation you've dealt with or a loved one has or someone you know. And we're going to talk when we come back about why it's important, if you suspect something, you act quickly. We'll be back right after this.